alaikum. I would like to continue my lectures about the explanation of the classification of periodontal disease and condition. And we discussed previously the periodontal health, gingival disease and condition, including biofilm-induced gingivitis and non-biofilm-induced gingivitis. Then we begin the discussion with periodontitis. The second type of periodontitis was periodontitis as a manifestation of systemic disease. A variety of systemic disease and condition can affect the course of periodontitis or have a negative impact on periodontal attachment apparatus. For example, of systemic disease and disorder that affect the periodontal tissue attachment apparatus, including systemic disease and disorder that have a major impact on the loss of periodontal tissue by influencing the periodontal inflammation. Here we have several syndromes, either affecting the genetic or occur as a result of immunologic disorder or as a result of immunodeficiency or inflammatory condition. In all these conditions, periodontitis occur as a result of, as a part of syndrome associated with many other symptoms or disease in the same person. For example of this disorder was genetic disorder, including diseases associated with immunologic disorder, such as Down syndrome. Also, we have disease affecting the oral mucosa and gingival tissue. We have disease affecting the connective tissue, such as Ehlers-Danlos syndrome, and metabolic and endocrine disorder. Second, the acquired immunodeficiency disease, such as HIV condition. And finally, we have inflammatory disease, such as inflammatory bowel disease. The second systemic disease and condition that affecting the periodontal tissue are disease and disorder that influence the pathogenesis of periodontal disease. Here, the occurrence of some disease may modulate the occurrence or pathogenesis of periodontal disease. Either the modulation occur on the immune system itself or modulate the dental plaque and microbial deposit found on the tooth surface. For example of this condition, diabetes mellitus, osteoporosis, and stress emotional condition that associated with any person. Third, we have a systemic disorder that can occur or result in a loss of periodontal tissue independent of periodontitis. In this condition, we don't have periodontitis, but destruction occurs due to interference of other diseases and conditions that affect the periodontal tissue. And for example of this condition, neoplasm, malignant or metastasis neoplasm, and other disorder that affect the periodontal tissue. The third type of periodontitis in the classification system of 2017 was necrotizing periodontal disease, including necrotizing gingivitis, necrotizing periodontitis, and necrotizing stomatitis. And I will start to discuss with you the necrotizing ulcerative gingivitis. This is an infection characterized by gingival necrosis, presented as a punched out papillae, as you see in the picture in the interdental area, with the gingival bleeding, pain, fetid odor, and pseudomembrane formation may be secondary diagnostic feature. The cause of these features associated with necrotizing ulcerative gingivitis is a fusiform bacteria, a Prevotella intermedia, and spirochete that have been associated with these gingival lesions. The predisposing factor may include emotional stress, poor diet, cigarette smoking, and HIV infection, while necrotizing ulcerative periodontitis is an infection characterized by all the previous symptoms that I mentioned it in ulcerative gingivitis, in addition to destruction in the periodontal ligament and alveolar bone of the involved teeth. In addition to the necrotizing ulcerative gingivitis and periodontitis that we have discussed, we also have necrotizing stomatitis, which is a very severe and aggressive form of necrotizing periodontal disease, showing extensive oral cavity tissue destruction and bone destruction, may involve lips, buccal mucosa. In necrotizing stomatitis, after the oral and mucous membrane are destroyed, the entire mouth is involved due to spread of infection.